Doctors typically advise people with diabetes to reduce their sugar intake or take their medications as prescribed, but they don't go into depth on how important it is for diabetics to consume the correct vitamins. Insulin won't function as well, nerves weaken, and complications can develop more quickly. The crazy part is that most diabetics are deficient in these essential nutrients without even realizing it. If you constantly feel exhausted, have aches, or have trouble controlling your blood sugar, it's likely that your body is lacking something crucial, and filling that gap could significantly improve your mood and diabetes management. Let's discuss which are most important and how to ensure that you receive enough each day. In order to support our efforts, please subscribe if this is helpful. Let's begin with the first one. B6 is the most important vitamin. Most people don't give vitamin B6 much thought. But if you have diabetes, you may be surprised to learn that your body uses more B6 for repairs when blood sugar levels are high because your kidneys flush it out along with extra glucose. In addition, inflammation and oxidative stress, which are common in diabetes, also cause your body to use up more B6. Many diabetics have low B6 levels without realizing the tough part because high insulin levels can also disrupt B6 metabolism, making it more difficult for your cells to use it appropriately. To make matters worse, some medications, such as metformin and blood pressure medications, further deplete B6. Low B6 may be the cause of your extreme fatigue, brain fog, or mood changes, even if a B6 deficiency doesn't necessarily have visible symptoms. Nerve problems are among the most significant warning indicators. Given that B6 is essential for nerve and muscle function, other symptoms may include tingling, burning, or numbness in your hands and feet, muscle weakness, or poor coordination, dry skin that is flaky or itchy. Other symptoms to look out for include frequent mouth sores and a weakened immune system. In extreme situations, low B6 can even result in anemia, which causes lightheadedness, pale skin, and dyspnea. A B6 deficiency can impact several bodily systems. It is important for fertility because low levels can lower testosterone and sperm quality in men and cause irregular cycles and, worse, PMS symptoms in women. The nervous system depends on B6 for nerve regeneration and protection, so without it, nerve injury might increase, increasing pain and reducing healing. It also impacts libido because B6 helps regulate dopamine and serotonin, which control mood and energy. B6 helps preserve the small blood vessels in the retina, and without enough, diabetic retinopathy can progress more quickly, leading to division issues. The kidneys need B6 to fight inflammation, and as levels fall, the risk of renal troubles increases, and health might suffer. Additionally at risk are the heart and blood arteries. When B6 levels are low, blood vessels become stiffer. B6 also helps lower homocysteine and amino acids that can damage arteries and raise the risk of high blood pressure, heart attacks, and strokes. B6 is necessary for glucose metabolism, which helps break down glycogen, the stored form of glucose, so energy is released gradually rather than spiking and crashing. Without enough B6, blood sugar becomes more difficult to control and insulin resistance can worsen. B6 is also essential for the production of neurotransmitters, which explains why low levels can cause anxiety, mood swings, and depression. The synthesis of hemoglobin, which transports oxygen in the blood, requires vitamin B6. Without it, cells don't receive enough oxygen, which causes weariness and delayed recovery. The best way to consume enough B6 is through food, and one of the finest sources is chickpeas. Approximately 55% of your daily needs can be met with just 1 cup of cooked food. Another powerful protein is beef liver, which has around 50% per 100 grams, while wild-caught salmon has about 40% per 100 grams, making it an excellent choice. Roughly 40% of daily B6 is provided by turkey per 100 grams, while roughly 30% is provided by sunflower seeds per ounce on 28 gram. These foods are particularly helpful for diabetics who enjoy fine dining because they not only raise B6 levels, but also improve immunity, metabolism, and nerve health. B6, a Japanese-style miso-glazed fish with 180-gram chickpea pet salmon, is a staple in several upscale cuisines. More than 90% of your daily requirements are met by 1/2 cup of chickpeas, which also provide heart-healthy omega-3s. Roasted garlic potatoes served with French beef liver. Pate about 85% of daily best is provided by 100 g of liver from one medium potato, combined with iron in B12 for improved energy and red blood cell synthesis. A Mediterranean dish of grilled lamb and chickpeas flavored with saffron. If your diet isn't sufficient, supplements can help. The best forms of B6 come in bioavailable forms, like P5P pyridoxal 5-phosphate, which your body can use right away. 200 grams of lamb and 1 cup of chickpeas provide about 80% of your daily B6, while also providing essential amino acids for immune support and muscle repair. One of the best choices is Thorne Research P5P33 milligrams per capsule because it supports nerve function and absorbs effectively. Pure encapsulation vitamin B6, 50 milligrams per capsule, which offers a reliable daily dosage, is an additional excellent option. Some foods and habits can actually make a B6 deficiency worse. For example, refined grains like white bread and pasta lose most of their B6 during processing, so it's best to avoid them. Additionally, diets high in sugar burn through B6 more quickly because insulin spikes increase the body's demand for it. Most diabetics do well with 25 to 50 milligrams per day, but if you're considering higher doses, it's best to check with your doctor. Another issue is alcohol, which hinders absorption and speeds up the liver's breakdown of vitamin B6. Over time, certain medications, such as birth control pills, metformin, and blood pressure medications, can further deplete B6, which implies it's crucial to refuel with food or supplements. The second most important nutrient for managing diabetes is vitamin E. Think of vitamin E as your body's natural shield, protecting your cells, nerves, and blood vessels. It may not receive much attention, but for diabetics, it's a game changer because it helps insulin work better, protects nerves, supports heart health, and keeps energy levels stable. Since vitamin E is a fat-soluble vitamin that requires good lipids for effective absorption, diabetics burn through it more quickly than normal. High blood sugar also increases oxidative stress, which means your body must use up more vitamin E to stave off damage. However, fat metabolism isn't always effective if you have diabetes, which makes it even more difficult to maintain healthy levels. The problem with insufficient vitamin E is that symptoms aren't often immediately apparent. Muscle weakness or coordination issues could be the initial symptoms. Vitamin E is essential for nerve function, so when levels fall, messages between your nerves and muscles are compromised, resulting in numbness, tingling, or burning. Low vitamin E may be the cause of visual issues, including difficulty seeing at night or increased eye strain, and sensations in your hands and feet may worsen, making neuropathy more painful if your skin feels dry, itchy, or sluggish to heal. A vitamin E deficiency can affect almost every system in your body, including fertility, because it's necessary for men to produce healthy sperm and eggs. It also helps protect the tiny blood vessels in your retina, so if you find yourself getting sick more frequently, that could be another indication. Low levels can alter hormone balance, leading to irregular cycles or pregnancy difficulties and lower sperm quality, making it more difficult for women to conceive. Because vitamin E enhances blood circulation, which is essential for sexual function, libido may also suffer. Insufficient vitamin E also has negative effects on the brain system. Since oxidative stress is a major cause of kidney damage in diabetics, vitamin E protects the blood vessels in the retina. It also helps keep arteries flexible, reduces inflammation, and prevents cholesterol from oxidizing, which lowers the risk of heart disease and circulation issues. At the cellular level, vitamin E acts as armor, protecting your cells from oxidative stress, stabilizing cell membranes, preserving essential fats inside your cells, keeping your nerves, muscles, and blood vessels strong, and improving insulin sensitivity by reducing inflammation and facilitating glucose's easier entry into cells. An additional significant advantage: it replenishes other antioxidants, such as vitamin C, bolstering your body's defenses overall. Without enough cells, your body becomes weaker, more inflammatory, and more vulnerable to injury, which accelerates the consequences of diabetes. Fortunately, increasing your vitamin E levels may be done naturally in a number of ways. One of the greatest sources is sunflower seeds. You can meet almost 66% of your daily needs with just one of 28 G. Almonds are, again, another excellent choice. Hazelnuts are a simple snack if you prefer vegetables because they include around 48% per ounce, while hazelnuts give about 28% per ounce. 1 cup of cooked spinach provides 20% of your daily need. Another excellent source is avocados, which provide you with about 15% of a medium-sized fruit, along with the good fats required for improved absorption. Some expensive dishes that are strong in vitamin E are Mediterranean-style grilled sea bass with an almond herb crust, if you like fine dining. 180 of fish. Japanese roasted duck breast with a hazelnut miso glaze, 1/4 cup almonds, and heart-healthy omega-3s provide more than 70% of your daily intake. Duck weighing 200 grams, about 65%, can be obtained from 1/4 cup of hazelnuts, which provide a rich flavor with potent antioxidants, and a French avocado tartar with sunflower seeds and truffle oil. 150 grams of avocado. If food isn't sufficient, high-quality supplements can help. 2 tablespoons of sunflower seeds provide almost 60% of your daily vitamin E in a nutrient-dense, opulent meal. The best option is natural vitamin E D-alpha tocopherol, which is better absorbed than synthetic versions. Pure encapsulations of vitamin E. 400 IU per soft gel are also a great option because they offer a potent and bioavailable form. Another solid option is Now Foods Vitamin E 400 IU per soft gel, which contains a balanced mix of tocopherol for broad antioxidant support. Most diabetics do well with 200 to 400 IU per day, but it's important to avoid going overboard because too much vitamin E can thin the blood. Low-fat diets can also be problematic because vitamin E requires healthy fats for proper absorption. Even how you cook matters. Overcooking vegetables destroys much of their vitamin E, so lightly steaming or eating them raw is the best. Vitamin E plays a huge role in protecting against diabetes complications, but most people are unaware that they are running low. It helps insulin work better, protects nerves, keeps blood vessels flexible, and reduces inflammation. Increased amounts of refined carbohydrates and sugars cause inflammation, which makes your body burn through more vitamin E. Getting enough vitamin E from food or supplements helps improve circulation, increase immunity, and keep your body more resilient against complications from diabetes. This is especially important if your blood sugar has been difficult to control, your nerve pain has been worse, or your skin seems drier than usual. If this was helpful, please subscribe to help us continue our work. If you have any questions, please leave a comment. Let's now discuss vitamin C number 3. Most people don't think about vitamin C until they're running short, which is more common than you might think for diabetics. Elevated blood sugar levels burns vitamin C more quickly. Because glucose and vitamin C enter cells via the same pathway, too much sugar prevents vitamin C from being absorbed properly. Additionally, diabetics experience higher levels of oxidative stress, which means their bodies require more vitamin C to fend off damage. Because vitamin C is water-soluble, frequent urination removes it, making the deficiency even worse. Vitamin C doesn't often have immediate symptoms, but if you're constantly feeling tired, it could be because it helps your cells make energy. If you bruise easily or notice that wounds take a long time to heal, your body isn't producing enough collagen, and vitamin C is essential for bleeding gums. Since vitamin C helps prevent cartilage from breaking down, dry skin and frequent illness can also be signs of a deficit. In more severe situations, a deficiency can result in iron deficiency anemia, which causes dizziness. In addition to making you feel lethargic, having weak and pale skin due to a lack of vitamin C can affect important bodily functions, including fertility, as vitamin C shields male reproductive cells from oxidative damage. Since vitamin C is essential for blood circulation, which is crucial for sexual function, low levels can make conception more difficult. Diabetics are already at a higher risk of nerve damage, and without enough vitamin C, symptoms of neuropathy can worsen. The kidneys depend on vitamin C to fight inflammation and oxidative stress, so low levels can increase the risk of kidney disease. It also helps with sperm production and motility. Because vitamin C shields the retina's small blood vessels, health also suffers. Low amounts can hasten diabetics' vision loss, but the heart and blood vessels are most affected. Vitamin C keeps arteries flexible, lowers inflammation, and helps avoid plaque accumulation. Blood pressure is stiffened by blood vessels, increases the cellular risk of heart disease and strokes. Vitamin C is a potent antioxidant that shields cells from the harm that high blood sugar causes. In addition to supporting collagen production, which maintains healthy blood vessels, skin, and tissues, and lowering oxidative stress, a major contributor to insulin resistance, it also strengthens the immune system by assisting white blood cells in fending off infections. It also plays a crucial role in regenerating other antioxidants, such as vitamin E, which strengthens your body's defenses. Without enough vitamin C, cells become inflamed, age more quickly, and function poorly, which accelerates the progression of diabetes complications. Fortunately, getting enough vitamin C through food is simple. Kakadu plums are the best source around. Over 3,000% of the daily need is met with merely 100 g. Red bell peppers are a simple and convenient choice, offering roughly 200% per 100 grams, while kiwis provide around 150%. Acerola cherries are another powerhouse, with about 1/600% per 100 grams. With over 90% per 100 grams and additional fiber to aid in blood sugar regulation, strawberries are also a fantastic option. If you like fine dining, several expensive dishes are strong in vitamin C, such as a tropical ceviche made with fresh kakadu plums. A 150-gram piece of citrus-marinated salmon and red bell peppers provides more than 2,000% of daily requirements. A 180-gram portion of Japanese yuzu-infused tuna tartare with kiwi salsa offers more than 1,000%, providing a delightful blend of acidity and umami, similar to French acerola. Since not all forms of vitamin C are efficiently absorbed, liposomal vitamin C is one of the finest possibilities. A 120-gram amount of cherry sorbet with dark chocolate shavings provides over 800% of daily vitamin C needs while satisfying sweet cravings without raising blood sugar levels, because it more effectively enters the bloodstream. For quick absorption, Live on Lab's liposomal vitamin C 1,000 milligrams per packet is a great choice. Pure encapsulations ascorbic acid capsules are an additional wise option. 1 milligram each pill offers a straightforward yet efficient dosage. The majority of diabetics respond well to 500 to 1,000 milligrams daily. However, larger dosages may be beneficial during illness or periods of elevated oxidative stress. In fact, certain foods and behaviors can exacerbate vitamin C deficiency. A high-carb diet makes it more difficult for your body to consume vitamin C because too much sugar prevents it from entering cells. Alcohol increases oxidative stress and depletes vitamin C reserves. Vitamin C is destroyed when veggies are cooked at high temperatures. Thus, it is preferable to steam or consume them fresh. Another significant issue is smoking. It rapidly depletes the body's supply of antioxidants by burning down vitamin C. Stable vitamin C levels are also more difficult to maintain while eating highly processed diets devoid of fresh fruits and vegetables. Whether you receive it from food or high-quality pills, vitamin C is one of the simplest methods to boost your immune system, improve insulin function, and protect your heart. It helps avoid problems like neuropathy, renal disease, and vision loss. Getting adequate vitamin C can have a significant impact on diabetes management and overall health. Low vitamin C may be a contributing factor if you've been experiencing persistent fatigue, delayed healing, or recurrent infections.